Okay. Hi, everyone. Thank you so much for tuning in with us today for this awesome webinar. I'm here with May Friedman and Sabrina Friedman, and they are going to present to you their PowerPoint Too Fat to Fit, examining fat fear and the role of size acceptance. There will be a Q&A at the end, so folks are welcome to type in any questions they have, and we'll keep track for the Q&A. And if anyone's having any trouble with audio or with video, please type in the comment box and I will help to address that. So I'm going to turn it over to May and Sabrina. Thank you so much.
Great, thanks, Kelsey. Scoot up here. So, hi, thank you for showing up today to our webinar. We are really excited to give you more information on the topics of fat and fat stigma and fat activism, and as well as some of the overlaps with disordered eating. And so thank you so much for being here and giving us the opportunity.
So we want to start by just letting you know a little bit about us. My name is May, and I'm a professor of social work at Ryerson University. And my background is in feminist studies, women's studies, and a lot of the work that I do these days is around fat and fat acceptance, and looking at some of the intricacies about the ways that fat identities overlap with other identities.
And I'm Sabrina Friedman, and I do have my master's in social work. I was a social worker, like clinical frontline social worker for a couple of years in New York City in foster care with teenage female-identified young people. But I realized that frontline work wasn't really for me. I came back to Toronto and I explore other avenues of helping people out or working in the community. I am currently a music teacher at 3 schools, and I also am a community programs director at a community organization. So thanks again for having us. So we have like a lot of ideas we want to cover today, and we want to make it clear it's really just a broad overview what we're going to be talking about, and either of us or both of us could talk pretty endlessly on any of this. And so if you want to get our contact info, you can get it through NEDIC, and we would, if you want to continue the conversation after today.
If I can just interrupt for
Sure.
a second, I'm going to see if I can turn up the speakers a little bit.
Sure.
Thanks, everyone, for your patience. It could be the fan.
Folks can't hear us is the problem?
We're just having one comment that is a little hard. Maybe we'll just move this a little closer as well and see if that helps.
That's totally cool.
Okay.
And we can also speak up.
All right. Sorry about the interruption, everyone.
Thanks. Okay, go for it.
So we want to start with a note on language. Both Sabrina and I think of ourselves as fat people, and that might be something that might have caused some of you to flinch, to note that we're referring to particular bodies, including our own, as fat. Fat obviously refers to a bunch of different things, the literal substance in and on our bodies, but also obviously the ways that we think of and describe particular people. Sorry, just trying to flip. So there are negative associations that are associated with fat. Fat people are seen as lazy, fat people are seen as unhealthy, dirty, out of control. Fat people may be seen as asexual or hypersexual. So given that we know that these negative associations are overlaid on fat bodies, why would we choose that word? Why would we choose to refer to ourselves as fat?
And I'm going to answer that. We use this word because we draw from activists and academics who have reclaimed words like this, or like other words such as queer. And we also appreciate that it's like a loose term. It doesn't suggest that there's an empirical correct weight that some people might be over. So we stray away from words like obese or overweight, again, because they imply that there's some magical number that if people are over or under, that somehow categorizes them in certain ways. But also the term fat just allows us to acknowledge that fat is seen in different ways in different cultures, different communities, different nations, and different ages of the world. So we like that as well, that it's a flexible term.
So beyond this piece around language, you may be curious to hear about why we would want to talk about fat at all to an audience of people who are thinking about eating disorders. Or maybe you're not, but we're going to assume for a minute that you are. So there are a few myths that sit underneath that discomfort, and we want to just take a moment to unpack those myths. First, there's an assumption that fat people or people that experience weight stigma don't ever experience disordered eating, and this is totally false. In fact, in the same way that looking at someone's body size does not tell you anything about their health, and we'll talk about this more later, we also can't guess who struggles with disorder in terms of eating and weight just by looking at them or by knowing their size, and we'll attempt to unpack this more as we go on.
And if we look at it from the perspective of critical disordered eating research, there's also a concern that disordered eating can often be constructed as only medical or psychological. And it also discredits what we feel are some of the root causes of disordered eating for a lot of people. And for example, one of those things is just the way that we're all socialized to hate and to fear fat bodies. And that the societal dysfunction that we all live in a world that is so weight obsessed. So mainstream responses to eating disorders situate the problem in the person. And we want to be intentional in speaking today about removing some of that individual responsibility.
Mm-hmm.
I'm sorry.
That's totally
We're just
fine.
getting a couple more comments, but it's still a little bit challenging to hear. So I'm gonna.
Do you want to pause we can just turn the fan off. Maybe that'll help.
Maybe. Okay, let's try that one.
And I can speak up as well.
All right.
So, by contrast, today we want to consider that some of the root assumptions and biases that impact our lives are meaningful across all sizes and experiences of people. So, in other words, people with eating disorders come in many shapes and sizes. Fat people intersect with lots of identities around race, sexuality, age, and so on. But across all of our differences, the one thing we all have in common is that we all live in a world that is both hostile to fat and encourages a rampant fear of fat. And that common ground is why we think that this webinar is relevant to this audience.
Great.
As a result, today we're going to look at some of the stigma and discrimination experienced by people who are seen as larger than normal. But we want you to think through the ways that stigma may contribute to body image and body management practices for people of all sizes.
And so we're just going to walk you briefly through what we're going to be reviewing today. Next thing we're going to speak about is the impact of living in our world, in our context, in a fat body, and what kinds of things, fat folks tend to experience. And then we're going to move to talking about myths of fatness, so both the myth of choice and the myth of fatness as it relates to health. We're then going to move to talking about the model of health at every size, and you'll hear us referring to it sometimes as HAES, because that's just the acronym. And then we'll talk a bit about fat and size acceptance as part of, the last part of health at every size, of self-acceptance. And then we're going to pass along some resources that we really like. And with that, I'm going to pass it back to me.
So we want to start by thinking about some of the impact that living in a fat body has, and we're going to focus on some of the areas where being a fat person in the witch hunt of our culture has deep, serious, and very real effects. So we're going to do that by taking us through a sort of timeline of one's experience of being fat and what sort of impacts there may be in areas such as school, the workplace, medical settings, and in adult life.
So I'm just going to start us off on the journey of a fat person, and I'm going to start us with the kind of impacts of being a fat child or a teenager in school. And so there are very real consequences to living in a fat body from our youngest ages onward. For example, children experience ostracism from nursery all the way through college. They sometimes or often develop low self-esteem, and they can be discouraged by education professionals. They can be deprived of places on honor roll, sports teams, and cheerleading squads, denied letters of recommendation, and even once they are given recommendations or on their way to college, the colleges themselves can be less likely, especially if there's an in-person interview, they can be less likely to admit equally qualified fat applicants. And when children are really focused on their size, and when that's brought to their attention a lot because they are living in a fat body, they can tend to eat less, which can slow their growth or delay puberty. And this is the thing too, when you think about school anti-obesity programs or programs of the nature, when they eat less, they're praised, children. And in fact, that calorie counting and intense monitoring of food intake and over-exercise, these are all actually what we would probably consider disordered behaviors. And the thing is, they are disordered behaviors regardless of the size of the person engaging in them.
So with respect to healthcare and medical institutions, We're going to talk a little bit about it now, a little bit more in later when we talk about the relationship between fat and health. But briefly, we know there's ample research to suggest that healthcare providers view fat patients negatively and avoid spending time with us. We know that both personally and professionally. We also know that when we go to see the doctor, that it doesn't matter what we've gone in for, whether it's, athlete's foot or strep throat, we're still told that it would probably be advantageous for us to lose a little bit of weight. And for those of us with histories of complicated eating, which I would argue is probably all of us, this may be damaging and may trigger relapses in our journey toward healthy relationships with food. We know that nurses hold negative views about fat patients, and that even doctors and researchers who specialize in obesity harbor stereotypes of fat people as lazy, stupid, and worthless. Curing our fatness is meant to help all of those problems. But there's a bias in that research, therefore, that really starts from a presumption that there is no worthy fat life. And that means that this research ends up getting done in very particular ways with these assumptions that underpin. Students of exercise science see fat people as bad and lazy, and mental health professionals are more likely to evaluate fat people negatively. Now, we know that the treatment paradigms for eating disorders can be infantilizing and apolitical, and we want to argue that this is also true for the ways that fat people get often treated in healthcare settings. Similar language is used in that both fat people and people with disordered eating are assumed to be out of touch with reality, and often re-education is the desired treatment protocol. But what is troubling to us is that the re-education for fat folks, whether or not they in fact have eating disorders, is often being told to undertake behaviors that resemble the exact behaviors that send people to eating disorder treatment. So we start to see the cycle and the problematic impact.
And I know we didn't mention it when we began talking about all this impact stuff, but all of the facts and percentages and things we're talking about come from various texts we've read, peer review research, a bunch of studies that we've compiled and just taken the important bits that are relevant to us. Let us know if that's better. And kind of just compiled them up for this talk, but we're happy to share where we got all this information at the end, or if you contact us separately. And so I'm just moving to talking about the institution of the workforce. And just to point out for a second, our picture here with the fatter salesperson feeling sad and saying, why don't I have any sales this month? And all of the thinner coworkers are celebrating their amazing sales. This picture does illustrate our point, but it also actually comes from this listicle that I found. It's actually really horrible, and it is called something like the 16 toxic reasons not to hire fat people, and they go on and on and on about a bunch of myths and stereotypes about fat people and why it's better not to hire them. So just to say, it's really rampant and it's out there and it's bad. But just to move to talking about the institution of the workforce itself, 93% of human resource professionals have said that they would hire a normal weight applicant over a fat applicant with the same qualifications. And 15% wouldn't promote a fat person. And 1 in 10 think it's acceptable to fire someone just for being fat. Fat folks are often perceived as unfit for jobs requiring face-to-face interactions. And other studies have found that employers, admittedly, they will routinely turn down promising fat applicants simply for not fitting the corporate image. There's a lot of studies to suggest that fat people, and specifically fat women, earn less on average than their normal weight counterparts. And actually, there are studies that show that even women who weigh only 65 pounds more than average receive 7% less in salary, which sounds like not very much, but begins to kind of build on this issue of inequality. And also, some employers think it's okay to overcharge people for health insurance if they happen to live in a fat body, or can regularly just dock pay if those folks don't lose weight.
So with respect to other social institutions, we have read studies that show that it's harder for fat people to find housing, that landlords are 50% less likely to rent to an equally qualified fat person. Fat people are officially barred from adopting babies from China and other international jurisdictions. And talking about pathways to parenthood as well, in Britain and increasingly in Canada, health clinics may refuse in vitro fertilization to fat women. So Fat people may be denied gender-affirming surgeries until they lose weight. That's something we're hearing increasingly and that we find incredibly troubling. And then, of course, there's just sort of the baseline problems of living in a fat body in the world in terms of accessibility. So chairs that don't fit, classrooms that don't fit, inaccessibility of public transport, airplanes, just our day-to-day pathway of walking through the world lets us know that we are unwelcome.
Sorry. Oh, go ahead.
It's okay. So far we've looked at some of the more measurable impacts of living in a fat body, but of course your mileage may vary because experiences of fat bodies may differ based on markers such as race, class, and sexuality, and the stereotypes about our bodies will also shift in examining these intersections.
Is the sound better now?
It looks like some folks are still having issues.
Okay.
Sometimes I turn this on, maybe just try a couple things.
We're just working on the sound. Let's try that. Okay. So let us know if this is better. Okay. So we can move to talking about other identity markers such as gender, other intersections. So, for example, women or women-identified people that are fat are often thought of, we only kind of have two places to go. We're either thought of as over-sexualized or completely asexual, and there's no really gray area for us. Fat women are often perceived as bad mothers, just because. And also the mothers of fat children, whether the mothers themselves are fat or thin or average or whatever, are often also perceived as bad mothers. So, for example, there's a concerning trend in child welfare circles that children have been removed from their homes based solely on the fact that they are oversized.
With the intersection with aging, we see that fat aging people are seen as worsening old age. So we already have a real disdain for older bodies, and we see older bodies as falling apart. But fat older people are seen as sort of hastening that, decline. And so the overlay of seeing that as irresponsible and as lazy is placed on fat older bodies. There's really interesting intersections around fat and class, because in some respects, we really expect poor fat people. We have an acknowledgement to some extent that it is expensive to maintain thinness, that healthy food is expensive, that exercise is expensive. But we want to trouble that a little bit and say that we think that it's a slightly more complicated and cyclical relationship than just having poor cause fatness. If you can't get housing, if you can't find professional clothes that fit, if you can't, get an education, if you are worried about being fired, if you're underemployed or precariously employed, all of those things also lead to poverty. So we want to suggest that people are not only fat because they're poor, but also, in fact, that they're poor because they're fat.
Right.
Now, when we examine the grim realities of being a fat person, suddenly eating disordered behaviors don't exactly seem so disordered. When we're told from all sides that the only way to lead a life of any quality is to lose weight, it makes sense that one will go to any lengths to do so. So basically, whether on a conscious or a subconscious level, the overwhelming loathing of fat is so pervasive that there's a kind of self-protection in taking steps to ensure that fat is avoided or eliminated. And this is especially true given the extent to which fatness and thinness have come to stand in for badness and goodness. Our size has a huge impact on our sense of self.
So many of us can relate to those feelings of superiority, or conversely, the feelings of self-loathing that come with counting every single calorie or gram of food that we consume or don't consume, each belt notch, the pound or inch that we've gained or lost, and every clothing size up or down. What's less obvious, though, is everything that we lose when we begin to focus solely on weight as a way of managing and taking back control in an oppressive environment. And that's a major factor in disordered eating.
So we appreciate that the information we've just shared with you is overwhelming, and we want you to know that we are overwhelmed by it too. When you hear about the many ways that being fat can make life difficult, it can lead to an assumption that we should all avoid fatness at all costs. And we want to challenge that assumption in a few ways. First of all, we want to focus on other identity markers that have been presumed to be problematic, where the focus has been placed back on the individual to change their identity in order to conform. So for many years, and to this day in many places, people try to pray the gay away. Many of us seek to literally and figuratively lighten our complexions, hide our ethnicities. We attempt to achieve whiteness at all costs. We attempt class mobility. We hide our roots. And we've tried these things too, we want to be clear. We've altered our bodies, we've monitored our weight. We've also tried to minimize all the other ways that we haven't fit in. And the one thing that we're sure of is that attempting to disappear is every bit as painful and violent as sticking around. And this is true whether we're talking about fatness or queerness or brownness or any other part of our bodies and our existences. In general, not only is it more painful, we found it to pretty much be impossible. Ultimately, our weight comes back, our self comes back, we are who we're going to be, and only in trying to celebrate that can we sort of survive some of the violence that's placed on us. So the only honest pathway we found to counter that violence is to push loudly toward justice and to attempt to welcome bodies in a range of sizes, races, abilities, sexualities, and so many things more.
So beyond thinking of the pain of attempting to change our bodies or fix them, we do think there's a real concern here in thinking about fat as something that is more easily fixed than other parts of our lives or our identities. So much of the negativity directed at fat people makes this assumption that fatness is something we choose, and that as a result, we should be able to choose differently. So this brings up the question, is fat a choice? How can we really suggest that fat is worthy of the same attention and, let's name it, the same degree of activism and political agitation as other identity markers if it's ultimately up to us if we want to be fat? So it's really important here to consider, as we've noted before, that the notion of fat as a choice has really big implications for bodies of all sizes.
So when we believe that fat is a choice, then people who aren't fat must make different choices to avoid fat. And if you spend 2 minutes sitting on a streetcar and reading ads, or eavesdropping at a restaurant or a coffee shop, or having lunch with your coworkers, you can immediately see that the choice to be fat or not be fat garners an obscene amount of public space. So this isn't just an important question for fat people buying into myths of fatness, seeing fatness as a choice. It becomes a governing practice for all bodies and not just for fat bodies. It's become our new societal standard. So, and what we want to tie in here is that people who live with disordered eating are at once rewarded for their body management behaviors, or at a certain point, they're conversely having their bodies commented on or punished for taking something that's a baseline expectation in our society, something we really expect everyone to do, which is relentless body management, and just doing it too well. And we know that this success comes at a very high cost for people.
And if we take fat as a choice, we ask for a level of self-regulation, which pathologizes so many normal human practices. For example, eating when you're hungry. These body management practices don't reflect the complexity of some of the unhealthy practices on the part of people who are both fat and thin. So whether or not fat is a choice is a matter of considerable debate with some very real implications, and we need to really think about it. Are we fat if we have a BMI that's in the overweight or the obese category? Are we fat if we are bigger than most of the images we see on TV, in movies, or in magazines? Are we fat if we wear plus sizes? Are we fat if you're one of the plus models on America's Next Top Model? And whether or not fat is a choice is partially predicated on which criteria we use to decide the magic normal size.
And we think this is especially important, this idea that fat is really floating and personal and context-driven in the eating disordered world, where people are understood as mad for seeing themselves as fat when some marker somehow decides that they're not. But given the violence aimed at fat people, it's important that we acknowledge that our ability to see our bodies accurately is really hindered. Maybe even more importantly, it's not just our size that we can't distinguish anymore. It's also whether we're eating food that nourishes us in both physical and emotional ways, whether we're moving to punish ourselves or because we seek joy, whether we honor and respect our bodies or belittle and demean them for being out of control. We can't tell anymore whether we're treating ourselves well, appropriately, because the onslaught of information on how to hate ourselves has erased our intuition and clouded our judgment.
And there's other confounding factors when we think of fat as something that people choose. As we alluded to, it's really expensive to take on the lifestyle required to maintain thinness if that's not your biological destiny. In fact, especially if it's not your biological destiny. Working out requires expensive equipment, gym memberships, personal trainers. Healthy food can be expensive, and more importantly, both exercise and the preparation of what one might call healthy food are require a lot of leisure time. So, and that's less plentiful to people that are poor, who are working multiple part-time jobs, who have kids, who have a lot of other things they need to attend to. So then we have to ask again, is fat a choice?
Whether fat is a choice is predicated on other identity markers. So for people who experience homophobia, they may especially fear spaces that require vulnerability, such as gyms or weight loss centers. So if we avoid fat-shaming weight loss culture because it might expose us to homophobia or transphobia, is our choice to avoid being in these weight loss spaces actually a choice?
What about our level of ability? The capacity to exercise in ways that results in weight loss may not always be accessible to folks with certain abilities or different abilities. And some people with different or disabilities might have less to say over their food preparation, especially if they require attendants or aides who do that stuff for them. So again, is fat a choice?
The range of normal bodies that we mentioned earlier also acknowledges that different bodies and body compositions will occur based on ethnicity, cultural aesthetics, and geographic location. So given the range of diversity of our bodies, can we say that fat is a choice?
So while everything we just said would tend to imply that fat is not a choice, we actually want to delve into this a little further. And we want to say perhaps we're actually asking the wrong question. When we ask if fat is a choice, we are buying into the rhetoric that attaches negative associations to fatness. Basically, another way of asking whether fat is a choice could be, should we feel bad for fat people, or instead of just judging them for being failures? And so we want to consider, as a parallel, the rhetoric around gayness. If there's a gay gene, then we can just pity queer folks rather than judging them, right?
So we think that the whole question, actually, of whether fat is a choice is a real problem, because it shouldn't matter if fat is a choice or if gay is a choice, in the same way that we don't ask left-handed people whether it's their choice to be left-handed. Fat arrives for many different reasons. Some fat people might not, despite all their efforts, have the capacity for thinness, where other fat people might just hate exercise and love more fattening foods. And what we want to take away from this is this idea of a virtuous fat body who's just the victim of bad luck, and that fat person is somehow okay, whereas the stereotypical gluttonous fat person should still be scorned and forced to change. We neither want to be seen as irresponsible or as miserable victims. Ultimately, what we want to be seen as just another variety of human that is benign.
And similarly, people with disordered eating may be constructed in that binary as well. Many folks maybe consider folks with eating disorders as victims, or on the other side as over-controlling weirdos or freaks. But neither of those descriptors offers any compassion or any critical understanding of the many factors that contribute to people's ultimate eating disorder experience. And the reasons for being fat, or for being a person with disordered eating, or for being someone who is both, they don't really matter as much as self-love, compassion, and kindness, and the capacity to understand all of these experiences as nuanced and complex.
Okay, so moving along, we can hear you thinking it, and we admire you for not yet saying it loudly, typing it loudly, but it's the elephant in the room. So we may have convinced you that fat people shouldn't be treated badly, and we may have convinced you that it's hard to be fat in our society, and the notion of fat as a choice is an open question or shouldn't be a question, but you can't buy what we're saying and just let the fatties stay fat, because isn't fat unhealthy?
Isn't it unhealthy? So in case you're doubting us or things we're saying at this point, we have many, many research studies to support the idea that fat and health are not linked in the obvious ways that many of us, or all of us really, have been taught to think. Here's a few of those studies.
So without getting into the specifics, although we are very happy to pass them along later if you'd like, here are some ways, and this is really brief, again, we could really talk about this kind of endlessly, but here are some small ways that linking fat and health doesn't really make sense to us. And to start with, there's the notion of causation versus correlation. So many of the studies that surround body size and assume that illnesses are associated with body size, such as diabetes and heart problems, these studies don't actually show causation, they show association. So the findings could realistically mean that fatness does not cause these health problems, but rather that these health problems co-occur with fatness. What we want to argue is that perhaps there's the same genetic or environmental roots to both fatness and certain health conditions. And so perhaps this is merely, again, a co-occurrence rather than necessarily something that's causative. We also want to argue that perhaps in light of that, maybe fatness is an evolutionary trigger to allow bodies to survive certain cataclysmic physical health issues. We also want to say that there's basically no control group for the fact that almost every fat person has been on a diet at some point, and often for the majority of our lives. So it's not clear to us that diets aren't responsible for the bad health outcomes, rather than fatness being responsible for many of the bad health outcomes that are pointed at us.
And specifically, not just diets, but that yo-yo dieting of losing a bunch of weight, gaining a bunch of weight, losing a bunch of weight, gaining a bunch of weight. That's really hard on our system, hard on our organs.
That's
so, right. So that's what we're referring to when we say that there. And so another thing here, this study came out last May. And if you have time, I encourage you to just read through this abstract here because it kind of gives us all the information we need. But I'll just point out the important parts. Unsurprisingly to us, perhaps unsurprisingly to many of you, a huge study came out last year, this one right here on your screen. It was looking at about 40,000 representative Americans. So just random folks over the age of 18, 40,000 of them. And it followed them over a 10-year period. And it actually found, big surprise, that BMI, or the body mass index, is actually a terrible predictor of health. So BMI is basically the number we can give to looking at someone and deciding their health. So now BMI is just a number we put on that. And both things are not a great predictor. So just to go delve a little further, the study suggests that fat people are over-scrutinized, and likewise, thinner people are underdiagnosed with all sorts of cardiometabolic problems as a result of assuming that we can use BMI, or really what someone looks like, as a health predictor. So I don't know if everyone can see what my mouse is doing, but I am just looking at about midway through the paragraph. Nearly half of overweight individuals, 29% of the obese individuals, and even 16% of obesity type 2 out of 3 individuals were metabolically healthy. So all those very fat people were actually totally fine. And moreover, over 30% of the quote-unquote normal weight individuals were cardiometabolically unhealthy. So that's a lot of people to miss and to send in the wrong direction.
And it's failing thin people and fat people when this happens, because the fact that certain bodies are over-scrutinized and certain bodies are presumed to be healthy without any further discussion, that's problematic for everybody. That's something that no matter your size, you should query, because it means that your care is not necessarily being responsibly put forth. I want to add one thing that isn't in our script, Sabrina, which is just that I think in addition to not having control around dieting, we also don't really have a good control about happy fat people. So hating yourself is also really bad for your health. And I wonder what it would look like if we could actually design a study that looked at people who are neither dieting nor miserable about it. Exactly. And I think that would be a hard thing to do, because we do live in such a fat shaming culture, and such a fat fearing culture, that it's hard even for us to not hate our fat a lot of the time, because we're given that message so ubiquitously and so loudly. But for me, I would want to understand, if I actually wanted to do a controlled study, what it would be like to be a happy, self-loving fat person who is not dieting versus other counterparts. And I think that research design I would find very compelling, but not something I'm likely to do, unfortunately. Okay, so I want to suggest with respect to health that we're also asking the question wrong. So perhaps fat people aren't actually unhealthy because of their physical symptoms, but because of the way they're treated within the medical institution. So we see in this study, we see in other studies, that there are bad health outcomes that are attributed to fatness, and what I want to do is question other possible causes for those bad outcomes. Within the healthcare field, imaging equipment such as MRIs and CAT scans often have weight limits and will not accommodate larger bodies. And often what that means is that we are left to navigate those systems and find machines that will accommodate us, often with life or death consequences. If we can't get accurate information about what's going on with our bodies, it's really hard to maintain any kind of physical health.
There was a study that showed that if the fatter a patient is, the less care a surgeon is likely to give to any kind of surgery they're doing, and the more likely they are to leave their instruments behind, sponges or surgical instruments, and that's an error that then necessitates more surgery. And as we know, multiple surgeries can result in infections, sometimes even life-threatening infections. So again, is it the fat that's unhealthy, or is it the surgeon leaving behind sponges?
On a more intimate level, fat women are a third less likely to receive breast exams and pap smears or gynecological exams, but we're no less likely to receive mammograms. And what that indicates to us when we look at that study is that basically fat medical professionals do not want to touch our fat bodies. In this study, we read that researchers admit that weight-based barriers to care, quote, may exacerbate or even account for some of the increased health risks that are correlated with higher weights.
And that feels like a big discovery and a big statement that it's the doctors and the nurses' attitudes towards us that make us sick and not our actual fat tissue. Again, 12% of well-educated women reported delaying or canceling physician appointments because they knew they would be weighed, and that delays treatment. And that was one study. And another study, fat women, even those who possess health insurance, avoid doctors because, quote, disrespectful treatment, embarrassment at being weighed, negative attitudes of providers, unsolicited advice to lose weight, and medical equipment that is just too small to be functional, end quote. So this is a study as well that just talks about sometimes we just don't go to the doctor because we know it's going to be a shaming and just bad experience. So we would argue that the adipose tissue, as I said, the fat tissue in our bodies is not what necessarily makes us sick, but maybe having our doctors and other care professionals provide low standards of care, that just might provide a different explanations for the bad health outcomes that are blamed often on fatness.
So I just want to interject here and say, we know that it's really hard to accept that fatness does not automatically mean a lack of health. It's such a ubiquitous assumption in the society that we live in today, and certainly in the last, I would say, 30 years or so, it's become a default assumption. And we have a hard time shaking it around ourselves, but we really want to ask you to keep your critical lens. We want you to think also about the ways that other identity markers have had negative associations that were perceived as obvious assumptions. So it was obvious for many years that racialized people were inferior. It was obvious for many years that gay people were hypersexual. And scientific studies proved those things. You can't see my scare quotes. It proved those things, right? So what we're asking you to do is maintain your critical lens and be open-minded about the idea that the obvious connection between fat and ill health could likewise be eventually debunked. But what we want to say is that that is not going to happen because the medical industry will suddenly have a change of heart and realize the error of their ways and get wider chairs in the waiting rooms. It will happen like other things have happened. It will happen through activism and sustained critical pushback. So
for now, we just want to get back to the idea of health and maybe a different way of relating to health. And this brings us to, as we promised, a conversation about health at every size. And so health at every size is a whole different way of thinking about health and bodies. And it basically just takes our weight and size out of the equation.
Mm-hmm. HAES is nothing less than a radical revisioning of our ideas of fat and health, because it forces us to consider that we can be healthy where we are now rather than deferring healthy choices into some mythical later. I want to just also take a quick moment and say that we're not immune to some of the critiques about health at every size and about healthism in general, and the way that health has come to stand in its own way as morality, that like we all want to be healthy because we all want to be good, is also problematic.
She had scare quotes. They were off screen. Good.
So we want to just put that out there. But within the constraints of the kind of, at least a better practice, a best practice from where we are now, we would argue that HAES really has a lot to offer. Furthermore, traditional paradigms of health are really only interested in physical health. So we want to consider what the impacts on our mental health are of sustained self-criticism, and whether we can maintain our social and emotional health when we avoid breaking bread in our communities in order to keep down calories. Health is multifaceted and complex, and our understanding of health is constantly evolving. So as social workers, the two of us feel very strongly that thus far an overemphasis on physical health has really come at the expense of us considering mental health and emotional health.
And we don't mean just us, we mean like the collective us.
Yeah. This is especially, though not exclusively, true for people who are grappling with weight in a variety of ways. And health at every size, we think, seeks to restore some balance in this regard.
So I'm going to start using the word HAES, which is, as we mentioned earlier, the acronym for health at every size. So don't get confused. We're talking about health at every size. We're calling it HAES. So HAES has three major components. The first, as you see at the top there, is intuitive eating. And simply put, we are so degraded by the fat phobia and the encouraged calorie counting or whatever else, food management processes in our society. We've actually stopped acknowledging our hunger cues, and that we're almost I think all of us, in one way or another, experiencing some form of disordered eating, if we think about it as like a spectrum. And intuitive eating, conversely, suggests that we just need to scan our bodies for what we're craving and eat whatever it is we want. I know it seems magical, but that's the first tenet. So if you want a salad, just eat a salad. If you want chocolate, guess what? Just eat the chocolate. And while Hayes does not explicitly suggest that we honor both emotional and physical cues, the two of us strongly feel that truly intuitive eating acknowledges that appetite is convoluted and driven by many different physical, emotional, and social factors. And we'd suggest that we need to greatly develop intuition. When I say we, again, I mean like all of us. We need to greatly develop our intuition and our ability to understand those cues from ourselves and in all of those spaces.
We appreciate that it's tempting to believe that if we remove the limits and the rigorous discipline that we all, dieting or not, experience with respect to food, we'll just go hog wild. And in particular, the notion of intuitive eating may seem impossible to people who are experiencing disordered eating. But it's precisely the cultivation of this intuition that we would argue might be required to respond to complicated or dysfunctional approaches to food. Trust your body to know what it wants. And we want you to take that trust into the second realm of Hayes, which is exercise.
Great. Hayes suggests that we find exercise that is joyful, and rather than exercise as a form of discipline or self-control. Kate Harding, who's the co-author of a wonderful book called Lessons from the Fatosphere, asks us to acknowledge that we are generally more active, actually, than we think we are, and that we don't even necessarily need to seek out that joyful activity, because a lot of us sometimes are already working pretty hard. For example, I'm a music teacher at 3 schools, so I'm often lugging my guitar, lugging various instruments. My job, because I work with very young children, often involves getting up and down off the floor a lot of movement, the energy of using my voice a lot, and singing and giving instruction also, as I said, uses a lot of energy, and teaching the children to dance and things like that. So rather than sitting around and being angry at myself for not going to the gym, it's actually probably healthier for me to acknowledge that I'm actually already doing a lot of movement and energy using. And if I acknowledge that movement that I already undertake, it actually causes me to then combat some of the shame that is much more to blame than my actual size. And it's one of the biggest reasons that, I or many of us don't move as much as we could. That stigma of being fat, it keeps fat bodies sedentary. And Hayes aims to provide tools to help with that.
Mm-hmm. So if the idea is to find something active that makes you feel good without the notion of weight loss or weight management as the outcome, the range of possibilities is really broadened considerably. And this is especially important for those of us, all of us, who come from intersected places. So, if you come from a different community where your needs might not necessarily be well met by traditional exercise outcomes, if you think about just trying to explore joyful movement and thinking about finding joy in a variety of ways, then maybe the lesbian soccer league may be a more healthful practice than a high cardio routine at a homophobic gym, for example. Hayes reminds us that honoring where you are in all parts of your life is a healthy practice. The final component of Hayes is perhaps the most important and the most radical.
So even on our previous slide, we called it self-acceptance, but I also want to push it a little bit forward and talk about it as size acceptance or fat activism. And this is still you.
Oh, sorry.
You're welcome. No problem.
We don't do the things that we do because we're flawed or unworthy. Rather, Hayes says that our bodies are wonderful and important and that we should allow them to feel accomplished and experience pleasure. And, we do this through fat activism. We do this through not only self-acceptance, not only an individualized practice, but rather by going out and trying to shift the world and shift the aesthetic and health, assumptions that are overlaid on our bodies, so that we do this as a much broader politic.
And so when we're doing fat activism, it can be in everyday lives, it can be in more organized ways. So there's 3 main ways that we like to think about ways to do fat activism. So the first is individually. That's kind of like a great example is if I'm going to a medical appointment that I know is for a rash and has nothing to do with my size. And if maybe I'm with a new doctor or I'm at a walk-in and they ask to weigh me, I know my weight has nothing to do with the thing I'm asking for. So in that moment, I would likely just refuse to be weighed because I know they don't really need that information. Another way that we can, have an area for sustained critical pushback is institutionally. So, for example, us doing this webinar today, and NETIC promoting us doing this webinar today. This is great. Fat activism and all of you participating. So yay. And then, of course, there is performance art, which is a really popular form of fat activism in the fat activism community. And I don't know if you can see, but on the bottom right of these images, it says sexy size 20, and there's a Kit Kat and a Twix and a I Heart Fat Girls in the back pockets. And that's actually a self-portrait. And I made a bunch of signs like that. One of them said, I love fat girls. Another one said, dance like a fat girl. And for those who know York University campus, in undergrad, I got all my friends and we went to the middle of Very Hall, which is a big acoustic-friendly main thoroughfare building. And I danced with my bright red underwear outside my leggings to look like a superhero to the song Big Girl, You Are Beautiful. And I got an A+ on that assignment, so that worked great. So we're just going to take a couple more minutes and just move to resources that we've compiled that we really like. And please feel free, if you know other resources, we would love to hear about them during the Q&A. But we're just going to briefly go over our resources, and then it'll be Q&A time.
Yay. And we want to say as well, like, we've really had to constrain and limit our access to a lot of the knowledge that we've tried to share today. So this is kind of the Coles notes on all of this, that there really is more robust analysis to offer here, and we've kind of given you really the sort of taste test, and so we hope that you'll come back for the full scoop. In terms of resources, we want to just say, more importantly, before we get to resources, that choosing to invest in size acceptance for us has been more fruitful and more healthful than attempting weight loss. So for all the ways that we see that it is violent and difficult to live in a fat body, for us, the healthful outcome, the safe outcome that we have located has been around choosing to take back that rhetoric around our bodies and love ourselves and push back that love into the world rather than trying to alter ourselves to conform. So do you want to start with NAFA?
I do want to start with NAFA. So there's two websites listed there. The second one is NAFA, which stands for the National Association to Advance Fat Acceptance. And May and I'd say, are a bit more on the left-leaning side, more feminist, more anti-oppressive in our practice and in our examination of all this stuff. And the NAFA website is a little less that. But the useful piece from them is they have tons of statistics and a lot of information. So if you're trying to convince a partner or a sibling or a parent or an in-law or whatever, if you have a skeptic in your life that you're hoping to persuade, the NAFA website is a great source of just quantitative information that can't really be argued with.
And they've been around since 1969, so this assumption that fat activism is a new thing, their website also really refutes that and looks at the history of this is another kind of civil rights movement that has an embedded backstory that's very different than just like a new, cool, fun thing. Like it's much longer than that.
Yeah, and I think it's not an accident that they framed the title, like the name of their organization, similar to the NAACP.
Yeah.
Go for it. Another thing, sorry. You might see the red book cover in the top right, and it's called Lessons from the Fatosphere, Quit Dieting and Declare a Truce with Your Body. That is a screenshot of the Amazon page where you can find this book. It's not as easy to find in bookstores or in libraries. It might be out of print.
No, I don't think so.
It's not out of print, but you can totally find it online. And it's written by two bloggers, Kate Harding, who we mentioned earlier, and her former blog is sitting right there as well. And it's a great entry point to this topic. So if you have a client or a younger sibling or a friend who's struggling themselves with body image, and maybe they are a fat person or they've been a fat person or they've been up and down as well, this is a really accessibly written and very queer-friendly book. And you swallow it up in like a day. It's very well written, very easy to read, and it's really a very liberating experience to move through that book.
Further to that, Shapely Prose, which is the other website that you have listed there, is the actual archive of Kate Harding's blog. It's not being updated presently, but it's a really lovely archive to dip into, so that's another place to get a similar quality of information. On a slightly more academic bent, the Fat Studies Reader, which unfortunately is out of print but can be found used, is a wonderful first resource for exploring the field of fat studies further, and it collects a lot of key readings on the topic and really approaches fat studies from a variety of angles. So it's a really wonderful intro text.
And actually, a bunch of the studies we read from during our impacts section we took from that book.
That's right. If you want to take the academic piece even to a more critical and more, just more robust place, Critical Dietetics, which is at the bottom right of the screen underneath the Fat Nutritionist, is a website that really is exploring, thinking about nutrition and dietitian science in a very different kind of way, very critical, very rigorous, and really a wonderful approach to these topics. Coming from the perspective of practitioners, the Fat Nutritionist is a Toronto area nutritionist who practices from a health at every size approach and who really seeks to de-link food and weight. So she helps people the way that nutritionists help people. She helps get back to the place where we can start to have a healthier, more nourishing relationship with food. But she does that from a place that isn't fat shaming and doesn't presume that your goal is to change your size, which is quite radical in and of itself. So we wanted to just make sure you knew about her.
And the last resource that we thought would be good to provide as the bottom left, it's the Facebook page for this these two practitioners. You can see their picture there, and it's called Be Nourished, and they provide like training in a lot of this stuff and a lot of these kinds of approaches to being practitioners, and as it says there, lose the weight of body shame. So it's all the way from dietitians and nurses and doctors to mental health professionals, therapists, social workers, psychologists, whoever you are. If you want to learn more about it or be a trained body trust professional, they offer webinars and seminars. Even though they are based out of the States, I believe California, they are a great resource for practitioners. And I see, Julie, thank you so much. We have been seeing your comments. Thank you. I just lost what she wrote. It's
Size Diversity and Health.
Size Diversity and Health was it org? Or?
Yeah,
.org is also from Julie. Thank you. A great resource as well. So we're going to do Q&A now. If you have questions, go ahead and type them in. Oh, I'm hearing from Anina that there's also a great GTA Haze Practitioners Facebook group. Awesome. Don't go all the way to California. Join the one that's in Toronto. Awesome. That's great. Thank you, Anina. And we're waiting for Colleen. And if any other people have questions, we'd love to field them too. We have just a few more minutes, but we're happy to keep talking if you want us to.
Oh, that's nice. Thank you, Colleen.
Thanks, Colleen. That's our hope. We hope to spread the fat love.
A really good resource, actually, in terms of thinking about this further is Fatitude, which is a movie. We didn't list it because you can't actually see it yet publicly. So we had a screening of it at Ryerson University in the fall, but it's not publicly available yet. But I think it will eventually be publicly available. So it's Fatitude, literally the word attitude with the word fat at the front. And it's a very fun but very effective documentary that really looks at fat shame and the way that discrimination against fat people across a variety of axes. So.
Yeah, and I'd say the lessons from the Fatosphere book and the Fatitude movie are great entry points to kind of, and they're easy, so it's a great place to start.
That's right.
If you have no academic history on this topic, or if academics just aren't your thing, they're very user friendly entry points to fat activism and talking about fat. Awesome. Great.
I saw a few people typing, so I don't know if folks have any additional questions. I see a couple question boxes, so I'm going to go take a look, and we'll give folks just another minute to type their thoughts. Oh, we see someone typing now.
Thank you.
Thank you,
Kaylee and Kristen. Kayla. Sorry, no, Kaylee is right there. Thank you.
All right.
Shout out.
We have one more person typing. In the meantime, thank you so much to May and Sabrina for taking the time to present today. At NEDIC, we're so appreciative that you guys have been able to come out and present this webinar for our audience, and thank you to everyone tuning in. We have someone else sharing another resource.
Oh, fantastic. Yes,
LindaBacon.org. Absolutely.
Yeah. Thanks, Ashley. So are you.
One other quick thing to add. One of the best things I feel like I've done with my job in the last year, just about Fatitude the movie, is that I went and spoke to a social justice group of 8th graders, and they all came and saw the movie. So first of all,
it was really cute.
It was accessible to them, but also I feel like what we actually need to do is embed some of this knowledge back down to thinking about how to change gym classes, how to change health classes. You know, my kids are constantly coming home and saying, like, we talked about obesity again, Mom, and they know that that's problematic. But I think most of their peer group does not. And so, you know, what I heard from my 11-year-old recently is that the kids in her class are willing to say, yes, she seems nice, but she's a bit big, in a way that they would not say about other things. They might think other things. I'm not saying that there aren't, you know, other problematic behaviors in that age group, but I think to figure out how we bring this conversation down and we really change the assumptions about which bodies have value, I think that has to start happening well before adulthood. And I would hope that that would change some of the culture that we're around.
So thank you.
So we have just another comment saying thank you for the focus on intersectionality, as well as another link that someone has shared as a resource.
From a Hayes perspective and their substance counseling.
That's great.
So that's awesome. Thank you. Oh, we can add ourselves to the Toronto group.
That's great.
Thank you. Maybe we will.
Yeah.
We probably will.
Yeah.
Thank you so much. All right.
Okay, so if there are no further questions, I don't see anyone else typing at the moment, so I think we're ready to wrap up. Thank you again for everyone tuning in. If you have friends who want to watch but weren't available, the webinar is being recorded and will be available on our website.
And once again, if you want to contact NEDIC for our emails or contact information, we're happy to have an ongoing conversation.
Okay. Great. Thank you.
Thank you so much. Thank you, NEDIC. Bye-bye.